Hello, everyone. My name is Jean Tiberio, and I'm a nutritionist and a wellness coach. Welcome to Healing Outside the Box. This is episode 210, and I'm calling it the 411 on functional medicine. But first, ladies and gentlemen, I've got to come clean with you. I don't know if you've watched the news lately, but it's making me pretty paranoid, quite frankly. And I don't mind saying that I'm paranoid because, as the saying goes, just because you're paranoid, that doesn't mean people aren't out to get you. Holy mackerel, they sure are. Now, if you've never heard that saying, God bless you because you're younger than I am. So now that we're living in the deep state, or shall I say the deep dark state, except for the rainbow of colors that is going to be Attorney General Barr's redacted Mueller report, we all need to get a little more paranoid and start covering up those peepholes in our laptops. I have to confess here that not once but twice I referred to our fearless leader as Carrot Top. I know. I've got to put on my tinfoil hat that I made just for this occasion and close up all those peepholes because, ladies and gentlemen, they're coming to get me. But my light at the end of the tunnel, hopefully a white light and not an orange light, is that when they finally get me, they will realize that a quadriplegic is just too much darn trouble and they'll throw me back. So I choose hope over despair. Now let's get back to the podcast before I change my mind. Now, let me warn you that I will be giving you basically what is my opinion on the subject of functional medicine. I've read other opinions as well, and I'm basically getting the gist that people have strong opinions about this functional medicine, one way or the other. First, let's go over a few definitions. Functional medicine people see themselves as part of this larger picture that is referred to as integrative medicine. And integrative medicine is referred to as a holistic practice which treats the whole person rather than just the disease in the person. It's basically a mind-body approach to promote general wellness and focus on prevention. Integrative medicine focuses more on, say, nutrition and exercise, and may use techniques like acupuncture, yoga, meditation, or reflexology. Functional medicine practitioners use this integrative medicine philosophy, but take it a step further and attempt to identify the underlying causes of a particular disease. They see each person as a distinct or unique patient, and they may personalize their healthcare plan for each individual. Even genetic or environmental data are put together in a package that is unique for each person. The office visits are generally longer, and a lot of attention is paid to improving lifestyle choices. A lot of lab tests are done to understand the current biochemistry. Functional medicine, or FM, is growing in popularity. There is now a center called the Institute for Functional Medicine, and now it's also coming under some scrutiny. Our desire to try something completely different comes as no surprise because most of us can look around and realize that we are all going to the doctors more and more and are often getting sicker and sicker. There's no question that technology, and in particular surgical procedures, are no less than amazing in their ability to fix whatever can be fixed, surgically that is. But when it comes to lifestyle-related chronic disease, our technology-driven healthcare system doesn't seem to be working very well. For example, the answer to the rise in morbid obesity is to simply cut out people's stomachs. That idea, and I guess it was an idea, was discovered by geniuses, and it's coming into question. Again, no surprise. So up pops a guy named Jeffrey Bland, PhD, and he started this new type of healthcare based on the doctor-patient relationship. Functional medicine is now moving into the mainstream, helped out by a physician by the name of Mark Hyman. And now this is my opinion. This all sounds wonderful until it starts to go off the rails. But let's start with the wonderful. Dr. Bland's idea was to marry public health with personal clinical care. He came up with the 5 pillars of functional medicine. They are clinical center of excellence, transformation of medical education, innovative research, health and community medicine, and philanthropy. Now, I listened to one of Dr. Bland's talks on YouTube, and I'll give you a few links to it in the show notes if you'd like to listen yourselves. Here's my gut reaction. He talks a lot about epigenetics and the future of medicine, which is fine, but let's give an example. He talks about the difference between dogs and wolves as being differences in their epigenetics. And again, that's all fine and dandy. But what is really happening inside functional medical offices? People want a realistic alternative to the primary health care, for sure, but does it deliver? There are several things that functional medicine does well, but one could argue that every good primary care doctor should be doing this. And they would be emphasizing good nutrition habits, adequate exercise, adequate sleep, smoking cessation, and stress management techniques like meditation. Functional medical doctors emphasize these things. They may encourage counseling or sleep logs. All good. They also spend more time with each patient, which is huge in my opinion. In my experience as a nutritionist, usually having an hour-long initial visit, I find that people generally start to open up after the first 30 minutes. I'm not suggesting here that medical doctors have that much time to spend with their patients, but 30 minutes would be wonderful. Another thing that functional medical doctors do is to emphasize prevention, as I'm hinting at with the focus on nutrition and exercise. Primary care doctors should do that, but do they? Perhaps the good ones do. Here is what Dr. Mark Hyman, one of Dr. Bland's disciples, is saying on the subject. Quote, by shifting the traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person, not just an isolated set of symptoms. Functional medicine practitioners spend time with their patients, listening to their histories and looking at the interactions among genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. In this way, functional medicine supports the unique expression of health and vitality for each individual. End quote. Well, no argument there. It's a good idea to listen to our patients. But isn't that something that good doctors are supposed to be doing? It seems to me that we may not need to reinvent the wheel when someone drives their car into a tree. Perhaps we should improve the healthcare system that we have now. People like Dr. Hyman who promote functional medicine say things like, quote, our society is experiencing a sharp increase in the number of people who suffer from complex chronic diseases such as diabetes, heart disease, cancer, mental illness, and autoimmune disorders like rheumatoid arthritis. End quote. Again, no argument there. But in my opinion, the medical community needs to get on the same page as to how we solve these problems. A physician by the name of David Gorski goes after the FM people and rips them a new one. Hopefully they have good health insurance to fix that. I'll include a link to the article in the show notes. In David's article, he also quotes a woman by the name of Harriet Hall, who says, open quote, what's good about functional medicine is not unique, and what's unique about it is not good, end quote. So here's what the naysayers have to say. Number 1, the functional medicine people say straight out that functional medicine addresses the root cause of disease better than conventional medicine. Maybe yes, maybe no, in my opinion. But whenever a bully in the playground says, I'm better than you, your natural reaction is to argue with him. Number 2, many of these physicians are selling overpriced supplements. For me, this is a real deal breaker. Whenever one of my patients tells me that they have spent hundreds of dollars on what I sense is bogus nutrition supplements, I want to cry. Very often these are people who cannot afford to blow that type of money. I don't need much of an imagination to guess how this conversation comes about. A practitioner may say, you're suffering from a deficiency of XYZ according to these lab values. then tell them that they need to get this high-dose supplement, or sometimes a supplement kit, to cure themselves. Number 3. Some of these practitioners offer very high doses of vitamin C. Now, vitamin C is not stored in your liver like vitamin A, which could be toxic. But here is the danger with super high doses of vitamin C. Because excess vitamin C is flushed out through your kidneys into the urine, you will get rid of a lot of vitamin C that you paid to have put in. Here's the problem with that. Once you stop that megadose of vitamin C, your kidneys will continue to excrete lots of vitamin C, allowing for the possibility that you could end up with a deficiency of vitamin C if you stop the supplement cold turkey, which you might do if you run out of money. A deficiency of vitamin C is called scurvy, and trust me, you don't want that. Number 4. They are not selling themselves accurately. This functional medicine model, which describes itself as a cycle of treatments combining mental, emotional, and spiritual what-have-yous, doesn't include vitamin supplements at all. This is really more accurately like a complementary or alternative type of care. In other words, meant to complement or add to traditional medicine rather than be the primary care model. Yet, physicians are setting up practices where they do hundreds of lab tests and prescribe lots of vitamins. In all fairness, they will promote preventative healthcare measures as I described above, but they don't brand themselves as complementary to reliable medical care. They brand themselves as primary care physicians. Number 5. FM practitioners tend to align themselves with groups of people who think that child immunizations cause autism. Most of us assume that we all put that idea to bed. Now, I'm not saying that there is zero risk involved in immunizing your child, but clearly most people feel that the benefits far outweigh the risk. Okay, so here's my opinion about this whole thing. As I said before, functional medicine offers some wonderful advantages as a supplement to traditional medical care. Practitioners are generally compassionate and take time with their patients. They empower patients to take an active role in their own health. They promote nutrition as front and center in everyone's healthcare plan. They encourage regular exercise and follow up with patients on these lifestyle issues. And I don't have a problem with practitioners encouraging techniques used in Eastern medicine, such as acupuncture. But as one of the critics pointed out, good physicians should be doing all of that right now. The problem I have with functional medicine is that, as yet, there are no studies supporting that it is superior to traditional medicine. I believe that practitioners sincerely believe that this theory of healthcare is a better way to go, but there is no proof backing this up. Because of the focus on nutrition and exercise, I want this to be true. But it simply is not the case that studies have supported their theories. In my opinion, functional medicine goes off the rails in 2 areas. Physicians like Dr. Mark Hyman sell overpriced and basically bogus supplements. And this practice pisses me off because physicians make enough money as it is, and the people buying these overpriced supplements may be living paycheck to paycheck. The truth is that most people will do just fine with a CVS or Walgreens brand of multivites with iron and maybe a mineral supplement if they're taking diuretics. That's really it. They should seek their physician's advice if they're taking other meds that might interfere with vitamin absorptions. If these physicians believe that the patients are eating a completely healthy diet, there should be no need to soak them financially with these overpriced supplements, sometimes up to $100 a month. Also, the practice of vitamin C infusions via IV also costs a lot of money. This practice, I can tell you now, is a waste of time and money. Yes, vitamin C is an antioxidant, but extra vitamin C just gets flushed out and ends up in the toilet bowl. A diet that's rich in fruits and vegetables with lots of antioxidants is the way to go. And once again, they should be eating a very healthy diet if they're following the practitioner's advice. The second area where functional medicine may go off the rails is that some practitioners may treat diseases like cancer with unproven methods. The growth rates for some angry forms of cancer are too fast to afford time to try things that are probably not going to work. Most common sense practitioners in traditional medicine would first use methods that are either known to work or known to work the best. If those methods don't work, then there may be room to try experimental methods. Now, I'm not a physician and don't pretend to know much about this area, but I'm convinced that listening to a physician that specializes in this field may be the best approach. Ultimately, I feel optimistic that we will figure all of this out. In other words, we will be able to take the best of both worlds and pull together an individual care treatment plan that works best for us, combining traditional Western medicine with proven alternative modes of prevention and treatment of chronic disease. Now that's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.